Hello, and thank you for choosing Northwest Specialty Hospital. My name is Mike Varga, Director of Pharmacy. As you've already heard from the pharmacist, we will be discussing your Coumadin or Warfarin therapy today. So why are you on Warfarin after surgery? As a post-op total joint patient, if we were to do no intervention, you would be at an increased risk of developing a potentially harmful clot. With interventions like sequential compression devices, TED hose, early physical therapy, and chemical clot prophylaxis, in this case warfarin, we lower that risk as much as possible. Warfarin works in the body by inhibiting your body from making clotting factors, synthesized by vitamin K. These clotting factors are responsible for forming clots. Warfarin does not completely stop this process, rather slows the process down, so after a surgery like a total joint replacement, the risk of developing a potentially harmful clot is extremely low. Warfarin requires monitoring to ensure safe levels of the medication. This is done through a blood draw or a finger poke. The lab value is called an INR, or International Normalized Ratio. When you are not taking warfarin, most patients have an INR of 1, meaning it takes a normal amount of time to form a clot. A goal INR value after a total joint replacement is usually between 2 and 3, which means it takes the blood 2 to 3 times as long to form a clot. When INR values are over 3, patients are more likely to experience bruising and bleeding side effects, whereas an INR value below 2 could potentially put a patient at risk for a clot. It is important that you follow instructions with regard to your dosing of your warfarin therapy after surgery. So what should we watch out for with regard to dangerous clots? There are 3 main areas of concern we will discuss: the deep veins of your calf, your lungs, and your brain. A clot in the deep veins of your calf is called a DVT, or a deep venous thrombosis. Thrombosis is another word for a clot. It usually presents in one leg or the other, not both, and is more common in the operative leg. It usually presents as a red, swollen, painful calf that can be warm to the touch or even clammy. If you are unsure if you are experiencing a DVT, please call your surgeon immediately or get to the emergency room. If the clot in the leg becomes large and unstable, it can break off and travel, and it usually will travel and get caught in the lungs. This is called a PE, or a pulmonary embolism. Embolism is again another word for a clot. If you were to experience a PE, you may have shortness of breath, wheezing, coughing, and potentially coughing up blood. This is usually accompanied by a localized pain in your chest. Your body does a good job of letting you know something is not right. Please listen to your body, as this is a medical emergency, and you will need to get to the emergency room as soon as possible. The last and least likely clot we are concerned about is a clot in the brain, or a stroke. As a patient, you would experience blurred or lack of vision in one eye, numbness or tingling in the face along one side of the body, slurred speech, and confusion. A caregiver might notice facial paralysis, confusion, lethargy, or tiredness. This is again a medical emergency and requires a trip to the emergency room as soon as possible. All of the clotting events I have described are extremely rare when a patient is on chemical clot prophylaxis and are doing physical therapy exercises according to plan. We do not intend to scare you with this information, rather give you the tools you should need to identify if you are experiencing any clotting side effects as described. The opposite effect, and more common, are signs and symptoms of bruising and bleeding. Signs and symptoms of common, non-emergent bruising and bleeding are minor bruising, minor nosebleeds, and possible bleeding of the gums when brushing your teeth. When on warfarin therapy, when you injure yourself, you may bruise more easily. However, all of these are usually minor, and unless bleeding is unable to stop after about 15 minutes, do not require physician intervention. Signs and symptoms of major bruising and bleeding include large diffuse bruising around your trunk, especially when you cannot remember a trauma to the area. Large amounts of bright red blood in the urine or stool, Coca-Cola colored urine, or coffee ground or black tarry stools. These can be signs that we have a bleed happening somewhere inside the body. If you experience any signs and symptoms of major bleeding as just described, please contact your surgeon immediately to determine if you need additional care. Again, it is not uncommon to bruise more easily while on warfarin therapy, but major bruising and bleeding events are rare. After a total joint replacement, you will be taking warfarin by mouth once daily. The dose is very patient-specific and will be managed by your surgeon's office or a Coumadin clinic. It is very important to take the warfarin exactly as prescribed and to remember to take your daily dose. The duration that you are taking the warfarin is up to your surgeon, and most commonly, patients take warfarin for 28 days after a total joint replacement. If you have questions regarding the duration of your warfarin treatment, please refer to your discharge paperwork or physician's office. It is important to let your physician know of all the medications you are taking, as warfarin can interact with a large amount of medications. One group of medications in particular that can interact with warfarin are known as non-steroidal anti-inflammatory drugs, or more commonly, NSAIDs. These type of medications can include Advil ibuprofen, Aleve, naproxen, or aspirin. These medications should be avoided while you're on warfarin therapy. The pharmacist will go over your specific medication list to see if you are taking any medications to avoid while on warfarin. Because warfarin is reliant on vitamin K to exhibit activity on clotting factors, it is very sensitive to diet and alcohol. The key with warfarin in your diet is to be as consistent as possible. It is okay to have green vegetables so long as you're consistent with the amount in your diet and do not binge on foods that are high in vitamin K. Imagine a teeter-totter. The more vitamin K in your diet, the more warfarin you need to keep that INR between that 2 to 3 range, which is safe. If you have no vitamin K in your diet and then have a large amount of spinach or other food high in vitamin K, the vitamin K overwhelms the amount of warfarin in your system and puts you, the patient, as a higher risk for clotting. Please refer to the list of foods containing vitamin K in the patient handout that will be provided by the pharmacist. At this point, we have completed the information portion of this video. Upon the return of the pharmacist, they will go over your specific medications and will be able to answer any questions you may have. Feel free to ask the pharmacist about medications you are taking while at the hospital, as well as other medication actions or side effects. Please refer to the handout the pharmacist will provide for a link to the hospital website if you should need to watch this video again. Thank you again for choosing Northwest Specialty Hospital for your recovery. We hope you have an excellent stay and best of luck with your recovery.